Hello everyone, I'm Jakub Hlávka and I'm the director of the Health Economics Policy and Innovation Institute here at Masaryk University, and today we'll talk a little bit about health economics. Health economics is a very cool field and I hope you all will be very interested in it, partly because it combines two different areas, healthcare and economics. And let's actually look into what these areas all contain. When we think about health, it is really not just about not being sick. When we are healthy, we are in a general feeling of well-being, we are able to be productive, contribute, and so forth. And it really determines how long we live and how well we live. Our quality of life is really important, but also there's many factors of this. It's not just whether we have a hospital near our home, but also what are the genetic dispositions, what is our behavioral behavior, what are some of the environmental factors. So a lot of things come into play when it comes to health. And yet, it is a very personal thing, right? There is no right way to define how somebody should live and what kind of health needs they might have over their lifetime, because it does depend on personal preferences. And so yet, this very simple thing, when we think about health, becomes kind of complex when we think about all the factors that come in and everything that we have to study to understand how health is created. Secondly, when we think about economics, of course, it is a discipline that studies how limited and scarce resources are allocated. That is something in economics we study in all the different fields, not just in health economics. But at the same time, we have to think about what we can do with those limited resources, and all the decisions we make have some trade-offs. Unfortunately, we cannot do everything we would like, and unfortunately, we cannot afford everything we would like. And so the concept of opportunity cost, where we have to weigh the different trade-offs and what it means to do something and not do something else, is very important. And economics is really the discipline that helps us navigate these difficult challenges. And so when we combine it all, we really come to the conclusion that healthcare is really not an exception to this rule in economics. We have to allocate scarce resources. Now, if we combine these disciplines, we really start thinking about questions like how do we create and how do we improve population health with the limited resources we have. First of all, we have to think about equity. So who gets the resources and who gets the care, healthcare they need? Secondly, how do we support and invest in new technologies and how do we reimburse new interventions? And then finally, in health economics, we also think about incentives. And that means really what affects behavior of physicians, patients, and insurers. And all of that is really kind of a complicated area because, as you can imagine, there's no simple and easy way to do this. But being more explicit and being very insightful about how we make these decisions can actually help us improve the status quo and can help us achieve a better outcome. Now, in health economics, we use many different concepts. But as I mentioned already, we have limited resources, we have scarcity of resources, we have to make choices, and we have to deal with opportunity costs. We also have to think about efficiency, and that means really how do we achieve a certain outcome with the resources we have or with greater or smaller resources, right? So we can actually get to a similar health outcome with fewer resources if we are smart about it, but how do we do it is very important. We have to think about equity. That means how do individual people benefit from the system and the resources that we have. And sometimes it actually means that some people have to wait a longer time if there's, for example, an acute case of a patient who needs care immediately. We have to think about incentives and behavior, and people like to be free and make free choices. And then finally, we have to really draw on data and evidence. And it is something that is kind of important because a lot of people have different opinions about healthcare and how we should do healthcare delivery. But at the same time, we have to look at data. And many countries, including Central European countries, are still a little bit behind some of the Western European countries in terms of health outcomes. And so how do we analyze these data to make better decisions? Now, healthcare is kind of a special market. In economic terms, we think about markets as a place where interactions occur between providers and customers. But we know that there's a huge amount of uncertainty in healthcare, perhaps greater amount of uncertainty than in many other areas, partly because we don't know when we'll get sick, and partly because we don't know what the outcome of a specific treatment will be. There is what we call an information asymmetry, and that basically means that providers and patients have different information. It sometimes means that the providers, because of their training and their experience, they understand what might happen better than the patient. But it also sometimes means that they are motivated by certain other elements and facts than the patients. Of course, the patient wants the best outcome for themselves, and sometimes they're willing to take risks and do things that might not be actually rational. So there is an information asymmetry we have to think about. Third, there is a huge factor, and that is insurance. Of course, in many areas of life we have insurance, but in healthcare, most of the spending typically gets covered by insurance. And that blurs the line between how we make decisions, because we don't see the ultimate price, and the choices that we make, right? So it is really something that insurance affects and sometimes leads to what we call moral hazard, when people make or take unnecessary risks because of insurance. And finally, we have a lot of innovation in healthcare. This is a great thing. We are able to treat many more diseases than ever in the past, but it does contribute greater spending and greater challenges for the budget. And so all of that contributes to this conclusion that healthcare is not really a simple or a perfect market where we have to understand all these different factors, but we cannot expect that simple rules and simple interactions of supply and demand will hold. So some of the core questions that we ask: how do people value health? How should we finance a fair and sustainable healthcare system? How do we even measure what works and where value is generated? And how do we look at innovations and think about the cost and access implications of these? Now, these are hugely complex questions, but some of these I think you might be interested to hear and learn more about in our master's course. One of the things I'll mention as I conclude is what we call the triple aim. That is really the combination or kind of a triangle that tries to show the different goals that we might want to achieve. One is, of course, improving patient care. So we want to improve the care for individual patients as much as we can, to reduce wait times, to improve outcomes. The second one, of course, is improving population health. So we don't think about individual patients only, but we really think about the whole population and what we can do the best for everyone, not just for individual people or subsets of people. And third, how do we do it in a cost-effective way? How do we reduce costs for things that might be too expensive and make this whole system more sustainable? And it is kind of hard to achieve all three at once. So there tend to be a lot of trade-offs. Sometimes we improve individual patient health at the expense of population health and so forth. So if you were to join us here at Masaryk University in a master's program in applied health economics, you would learn a lot of things. You would, of course, start to think about how do we even measure health and evaluate healthcare interventions. You would learn about financing, insurance, and incentives for the different stakeholders. You would work with data to understand how they can help us address important policy questions. You would learn about how we think about innovation and what it brings, but also what challenges it creates. And you would also be able to navigate the really complex interaction of stakeholders and needs behind public health, hospitals, and pharmaceuticals. At Masaryk University, our master's program is very much tailored to people who will work in the real world, who will address real policy problems. We, of course, study and work with national policy makers, but also international and global policy makers, such as the World Health Organizations, to understand how difficult challenges can be addressed across the world. We work with data and we teach students how to work with data. We also allow students to work on our research projects or to join some other research projects. And finally, we try to create a community that cares about not just health, not just economics, but really improving people's lives and using the different elements of health economics to achieve that. So at the end of that presentation that I just made, I want to highlight that health economics is not an easy discipline. It really means that you have to understand a lot of different factors. But eventually, if you choose this discipline, you'll be able to help a lot of people. And that, I think, is a great benefit. So let's kind of make sure that when you conclude this course and take some questions, you will actually understand that health economics is not just a discipline that addresses a simple problem. It is a discipline that is kind of an interdisciplinary field, but it addresses real world problem and actually can help people. And I think that is one of the great things that we do here at Masaryk University. So thank you so much, and I look forward to meeting you soon.